So hi everyone, my name is Oscar Flores. I'm one of the neuroradiologists from Lenox Hill. I'm just going to be a brief talk about just basic stuff about imaging of the spine. So my understanding is that most of the audience, are they college, high school? I'm not entirely
Yeah,
sure.
I would say the majority is high school through college, but we have medical school students and even older. So there is a range, but I would say most people are probably
Okay.
high school through grad school. Yeah.
I'll try to be as clear as possible with my language. If my language gets a little bit too complicated with terminology, I apologize. So if anyone has any questions, I can clarify as to what a term means. And so it's just because sometimes we get carried away with the way we phrase things. So if anyone has any questions about that, I'm more than happy to explain what I mean by that. So I'll just get started. So basically the spine, there's three parts to it. There's the cervical, the thoracic, and lumbar part. So cervical is the neck, thoracic is the chest region, and lumbar is the lower back. So here's a little picture of a sagittal, we call it also a lateral view of the spine. And here you can see this white structure is the vertebral body. This blue structure is called the intervertebral disc. And here on this left image, this is almost like a pathological or like a surgical way of seeing like how it actually looks in real life. This is just a little diagram. Um, and the rest of these structures here, so number two, this is where the nerve coming from the spinal cord comes out of the spine to innervate your body at whatever level of the spine that is. Um, Number four and five, these are called the facets. So these little bony outpouchings coming from the vertebral body. And so the reason I bring this up is because all these structures, knowing what these are is extremely important in terms of understanding the imaging. So this is kind of the same image, only instead of looking from the side, you're looking from an axial, we call it. So looking from the head down with respect to the patient. So this white structure here, this is a vertebral body. So this part is called the vertebral body. This thing here is one of your muscles called the psoas muscle. This is at the level of kind of the lower back. And this thing here is called the transverse process. This thing is called the spinous process. This circle here, this is where your spinal cord sits. We call it the thecal sac. And these structures here are called the facets. So here, this is a little diagram of a cervical vertebral body from an anatomy textbook. And it's basically just the same thing that we're seeing on the other image. So this is your vertebral body. This is your spinous process. This is called the lamina. This is where your spinal cord sits. And this, at the cervical spine, this is where an artery called the vertebral artery sits in this little hole here. And these are your facets again. And this is a lateral view of the same structure. So this is the spinous process, vertebral body. This hole here is where the nerves come out. We call it the neuroforamen. And then it's another diagram. So the C1, which is called the first cervical vertebral body, and C2, which is called the atlas is called C1, and C2 is called the dens. They're special vertebral bodies just because they're number one, number two. So they have a very different look to them compared to the rest of the spine. So this is C1, which is called the atlas, and C2 is called the axis. And C2 has this little special little thing called the odontoid process, which kind of pokes through, kind of sitting where the atlas is. And this is a X-ray of the lumbar spine. So this is kind of almost at an angle where we take this X-ray, and we like to call it the Scotty dog because if you look here, this looks like a head of a dog. This right here, this is like, call it a Scotty dog. It's one of the dog breeds. So this is almost a dog head right here. This is the little ears. This is the body of it. And here are the little legs. And the reason why we like to call it that is because it's a good way of looking for different kinds of problems that you can see with the lumbar spine. So on X-rays. So it's good looking at if there's any, we call it stenosis or tightening, where the nerve roots come out, which can often cause back pain. And as well as looking for some abnormalities that people have. You can have something called spondylolysis, where you essentially have a little defect of the bone right here at the neck of the dog, called spondylolysis. So there are multiple ways of, multiple methods of imaging the spine, but probably the three most common types that neurosurgery refers us to are these three. So radiography is another word for X-rays, CT, and MRI. There's other types, but because, given the wide audience that we have, I'll keep it simple. I don't think anybody has any questions so far, right?
Nope. You're good.
So that was just basic anatomy of the spine. Very, very, very brief. But it all comes back in terms of what we're going to talk about with these three things. So radiography, also known as X-rays, it's not that useful in terms of looking at what's going on with the spine, but it's pretty good for some stuff. It's good for looking for compression fractures, looking for alignment of how the vertebral bodies are oriented. Sometimes they'd like to do different X-rays where we have the patient flexing their back or extending their back, and then seeing if there's any motion of the vertebral bodies. We call that dynamic instability. And sometimes when they have surgery of the spine, they put some metal hardware, and that sometimes the X-rays can be good for looking for any abnormalities with the hardware. So looking in the post-surgical setting. So here's an example of an X-ray of the spine. This is the cervical spine. So I like this picture because it has these little three lines, and it's the way we're taught to read or interpret these X-rays in spines. It's this three-column thing, which I like. So basically, this is one column. This red line, this blue line is another column, and this third line is another column. It's a three-column approach, which they call it. So like this is one you'd like to look at. Whenever you're reading these cases, we'd like to divide into three things. So like the anterior column, the middle column, and the posterior column, because different kinds of pathology or disease happen in these different areas. So this is essentially the anterior portion. This is the middle portion, and this is the posterior portion of the spine. So here, these are your spinous processes, little pointy things here. Here are where your facets are. These little distances, this is where the nerves come out, and this is where the vertebral bodies are. So here, it's very good for looking for alignment. So sometimes you can get something called spondylolisthesis, where essentially one of these vertebral bodies kind of pops out relative to the other one, either posteriorly, where we call it retrolisthesis, or anteriorly, which we call it anterolisthesis. But that's just an example of X-rays. CT is better than X-ray. CT or a CAT scan is essentially like an X-ray, but what they do is they get X-rays but almost in 360 degrees, almost like in a circle. So it's a lot more radiation compared to regular X-ray, but you get to see a lot more of what's going on. You get to see, in addition to the bones, you get to see the soft tissue, the fat, the intervertebral discs, the bone, much better relative to an X-ray. So it's really good for looking for fractures, looking at the hardware in case they had surgery. So it's good for that. However, it's not the best one. MRI is considered the best one, just because you can't really see, I'll show you in pictures, what's going on in the spinal cord as much. But I'll show you examples. So here is an example of a CAT scan of the spine. So this is the cervical spine. So this is an example of a compression fracture. So it's basically, so this is C2, C3, C4, C5. So C5, there's a fracture here. This is an anterior compression fracture. Here you can see the little facets here. we call this view is sagittal, it's the lateral view. This is called the axial view. And then this view is called the coronal view. Here you can see the fractures right here. One here, this little line thing through the vertebral body. Here in the axial, you can see it beautifully right here. This is an endotracheal tube, so sometimes people get intubated. They put a tube down their throat, and all this air here, this is all, we call this emphysema. So they have air inside their soft tissues. So I'm not sure if maybe they had trauma, or maybe they had an intubation, but that's how air looks on a CT. So this is an example of a CT image with compression fractures of the cervical spine. So now let's talk about MRI. So MRI is the best one. That's the best kind of study we have for looking at the spine. And the reason is because you get to see a lot of the soft tissues relative to CT. You get to see what's in the spinal cord. Are there any tumors there? Is there any significant tightening of the nerve roots or of the spinal cord? It's really, really useful. And it's probably the best thing that we have so far in terms of evaluating the spine. So this is an example of an MRI image of the, in this case, the cervical spine. So MRI, they have different kinds of sequences. So you have something called T1, something called T2, and then you have other special ones. So this is an example of a T2 sequence. And the reason you know it's T2, because all this bright stuff here, this is where the spinal cord is. This dark thing is the spinal cord. This white stuff, that's the cerebrospinal fluid. So on a T2 sequence, the fluid is bright, because usually stuff that has water in them is bright on T2. So this is a T2 image. This is called a stir image. This is like this one, but the only difference is that they essentially nullify all the signal from the bone marrow. So if you look, the bone marrow or the signal from the bones here looks darker than the one in T2. And that's because it's all been setted out. And it's helpful because you can tell if there's any abnormal fluid that's not marrow. So that's why this is a very useful sequence. And here you can actually see these little bright things within the cervical cord. And this is a person who has multiple sclerosis. So you can see it here, for example. This is an axial T2, and here's a spinal cord right here. And there's this bright thing here. This is a lesion from someone who has multiple sclerosis. So you see this often. So oftentimes you see, we call them plaques, demyelinating plaques in the cervical and spine, commonly thoracic spine as well, and less commonly the lumbar spine. And they also have plaques in the brain too. So this is a very beautiful example of multiple sclerosis. So like the other image was T2, this is T1. So I'm just gonna go back one image. So this thing was bright, now this one is not bright. So that fluid surrounding the spinal cord is not bright. So that's your indicator that this is a T1 sequence. So this is T1. Now sometimes, for some cases, we'd like to give something called contrast. So contrast is something that they inject to a patient after they get a scan done, and that really helps us, the radiologists, in terms of seeing if there are masses, is there infection. Essentially, it lights up a lot of structures for picking up other additional findings. So CT uses a different kind of contrast agent. MRI uses a different one. So MRI uses something called gadolinium. That's what this GG stands for, gadolinium. So that's a contrast agent. So they scan them, they give them the contrast, and essentially it's better for looking, it increases the sensitivity for picking up other stuff in the spine. So the reason you know this is a contrast image is because you see little bright things here, and that's actually the veins in your vertebral bodies that are lighting up. That's how you know this is a contrast image. Post-contrast T1 image. So
Flores, I'm sorry to interrupt you, but I do have a question. So if MRI is clearly the best imaging, why would you even do X-ray or CT?
That's a good question. So MRI, well, I'll talk about CT and MRI. So CT has advantages that MRI does not. So the big disadvantage with MRI is that you don't see the bones that well. So CT, you can actually pick up a fracture much more easily on a CT than an MRI. So that's one reason. So really CT and MRI, they're almost complementary. So almost think of it, whatever the CT lacks, the MRI makes up for it, and whatever stuff that the MRI is not good at, the CT essentially fulfills that role. So a very good example would be bones. So that's one part. The X-rays, the reason I think we still use X-rays is because it's cost effective, and in terms of safety, it's much lower radiation. So MRIs are expensive. They're powerful magnets. They can take a long time. A lot of people are uncomfortable because they get claustrophobic, because essentially they're in this very tight space. It's very noisy. And it is pretty resource intensive, especially across the world where not every country has the same amount of resources. And I'm saying that because I know I'm speaking to a global audience. And also X-rays, they can answer a lot of the questions that CT and MR can do for a fraction of the price with a fraction of the radiation. So that's why X-rays are still being used, in my opinion. And also X-rays, they can pick up like a very big compression fracture, if there's any misalignment, and that you can do with an easy X-ray. You don't have to get a CAT scan or an MRI just to get that. So if it's a very simple question, like alignment or like a big compression fracture, an X-ray can do it for a very minimal cost and very minimal radiation. MRI does not have radiation though, but it is much longer and it's much more expensive resource-wise. So that's essentially it. Does that answer the question?
Yes, absolutely. Thank you.
Okay. All right, so here I have a little picture of, I'm just going to talk briefly about how we like to classify things in the spine. Like if you have a tumor, for example, in the spine. So they like to categorize these into these three things: extradural, intradural, intramedullary. So this is an axial view of the spine. This is a sagittal view right here. Axial, sagittal, axial, sagittal. So here's your spinal cord. This thing with the H thing in the middle of it. And then this thing here, this pink thing, is some kind of lesion. So lesion here, lesion here, lesion here. And lesion here, lesion here, lesion here. And then this thing is the spinal cord. So extradural lesion, essentially it's this thing here, but it's actually outside this, it's outside the spinal cord, but it's also outside the fecal sac. So the spinal cord, it's here, but it's also surrounded by this fluid-filled sac, which is called the fecal sac. So an extradural lesion is outside both of these things, the fecal sac and the spinal cord. So, and here you can see it right here. Spinal cord, fecal sac, lesion. Then you can have something that's intradural, but outside the spinal cord. So here, it's inside the fecal sac, but it's outside the spinal cord. And then you can have something called intramedullary, which means within the spinal cord. So the tumor or the lesion is within the actual spinal cord itself, and also within the fecal sac. So we like to categorize these things into these three categories. So I just put examples of that. So this, what did I put here? Oh yeah, so this A thing, this is an extradural lesion, this blob here. Here's a spinal cord. So star is the lesion, the yellow arrow is the spinal cord. B is an intradural lesion. So the Star is the lesion. This is a poor image, I apologize. And then here's a spinal cord. And then C is an intramedullary lesion. So this star thing is the lesion, and then this entire thing is the spinal cord. So it's actually within the spinal cord. Here, similarly, this is a sagittal way of looking at it. This lesion is within the spinal cord here on the left. Here, the lesion is outside the spinal cord, but within the thecal sac, so intradural extramedullary. And here we have essentially a compression fracture right here, but it's outside the spinal cord, outside the sac, so extradural. So that's that. So I'll briefly talk about a very common thing that we deal with spine imaging. It's called degenerative spine disease. A lot of people get this kind of imaging. A lot of people have back pain. It's very common across the world. So it sounds like a boring topic, but unfortunately, I think it's relevant to know because it is such a pervasive problem throughout all of our society, unfortunately. So degenerative spine disease, disc herniations, that kind of stuff. So again, I think you guys are sick of looking at this image, but again, this is a pure body. This is your spinal cord. These are little nerve roots, little green things. Here are your facets. Here's your transverse process, spinous process. So when you have a disc herniation, this thing, this is also called a nucleus pulposus. This thing actually bulges in to the spinal cord and gives you back pain. Here's where the nerve root comes out. So here's a coronal way of looking at it. All these little green things are the nerves coming out. Here's your spine. Here's the disc, and here the nerve is coming out. And here is an example of a disc herniation or disc protrusion. So they changed the way we should say, we don't like to say herniation anymore. They've changed the terminology. So I mean, I think for most people, they call it herniation, but we like to distinguish it between two different kinds of herniation, a protrusion and extrusion. They're a little bit different. But here, this is an example of that. So a protrusion looks like a tongue-like projection, whereas an extrusion looks like a mushroom. That's the best way to describe it. And here you can see it's actually, touching the spinal cord. It's probably causing problems for them back pain-wise. This is an example of something called spinal canal stenosis. So there's tightening of the canal where your spinal cord sits. So this is normal. This is not normal. And you can see how this entire disc, it's bulging in, and all these facets are very enlarged, and it's causing a lot of tightness. Look how wide this canal is compared to this. So this is spinal canal stenosis. And here's an example of it. Here you can actually see it. This is a T2 image. You can see this is the spinal cord right here, and there's that disc bulge pushing on it, and the facets are probably enlarged too. This is an example of canal stenosis. So this is an axial image. So in addition to you get tightening of your spinal cord, you can actually get tightening of where the holes where the nerves come out, called foraminal stenosis. So here we have a disc protrusion or a disc bulge. Here's your spinal cord. And here you can see the little nerves right here. Here's a little nerve coming out of the spine. And it's very tight. Look at it. Look, it has a squeeze through here. And again, because this thing is very enlarged, this thing is pushing on it. So that can also cause back pain. Here's an example from a lateral view. Here's that little hole where the nerve comes out. See, this is a normal one. Here you see all this yellow stuff is the fat. But look how tight this is. This is foraminal stenosis. This is spondylolysis. So this is where you get like a little defect of your anterior body. This is called spondylolysis. So it's all, lysis means separation. Here you can see on the CT, little defect here. This is your MR image. I like this because you can see the difference between CT and MR. And this is anterolysis. So this anterior body is anteriorly displaced compared to the one below it. We call it anterolysis. So this is anterolysis and spondylolysis. So that's it. I have example. I know it's 11:33. I know my colleague has to go on next. Does anybody have any questions?
I saw someone asked what could cause spinal stenosis.
Okay,
Um,
sure, I can go into that. I'm
yeah.
just gonna go back to this. So basically, many things can cause it, but you can have a tumor that can cause it. But most commonly, it's degenerative change. So I'm just going to go back to this picture here. Let me just blow this one up. So this image, this is a very beautiful example of probably the most common cause of canal stenosis. So here, this bulge, that can contribute to it. So you can have a protrusion or an extrusion. So this thing, and here the facets are very enlarged. So we call that facet hypertrophy. And also the tissue right deep to the bone is called the ligamentum flavum. We call it flavum hypertrophy. So this combination, facet, flavum, hypertrophy, and disc bulge, those three are probably the most common cause for canal stenosis and foraminal probably across the world in the older age demographic.